Yeah.
It's time for an interview, Frankie. Okay. Are you?
So SIBO stands for small intestinal bacterial overgrowth. That's where bacteria move into the small bowel. Typically, the small bowel is not supposed to have bacteria or large amounts, and your colon, which is the large bowel, are the ones that should contain the bacteria. Well, there are certain risk factors for SIBO. One is lack of B12. Sometimes you can have that. The other ones are poor intestinal motility, where the small bowel is not moving, and that can predispose you. And the other biggest one is being on what is called PPIs, or proton pump inhibitors, which are the medicines we take like Prilosec over the counter that decreases stomach acid, and that can change the pH in the small bowel, which could absolutely promote bacterial overgrowth in the small bowel. So the biggest one that people present with is bloating, and it's typically the bloating is pretty immediate after eating, or bloating after eating carbohydrates and sugar. Sometimes they'll get abdominal cramping, diarrhea, or even constipation, but the biggest symptom is bloating. Well, I mean, it can cause a lot of issues. I mean, you're walking around having discomfort a lot, bloating a lot. It can change your bowel habits. Obviously, there can be other side effects of SIBO, like skin problems, sleep problems, because of the toxins that are being produced. That's probably the biggest way. You can also get malabsorption, and then you wind up getting other vitamin deficiencies. So SIBO is typically treated in traditional medicine with a double course of antibiotics. It could be neomycin, it could be rifaximin, it could be metronidazole, and that's great. That can start the process, but about 50% of people that get treated will need treated again. But you really should then support it with proper diet, which is usually a FODMAP diet, and you should also support it with good supplements that can help decrease the bacterial overburden, as well as help break your food down further, such as digestive enzymes. So if you have many of these symptoms, such as severe bloating, and you can't really figure out what's causing it, come in and see us, and we can determine if you have SIBO. There's a breath test that we can do to determine if you have SIBO, and if you do, we can help you get it under control.